Hello and welcome. Over the past few days at Elma, we have been talking with different categories of people who are being particularly affected by the consequences of the COVID-19 emergency. With them, we would like to understand the current needs as well as those needs are likely to evolve once this crisis has hopefully ended. Today, we are here with Philip Smith. Philip is a patient with a rare condition that affects the kidneys. This condition is called IgN, and IgN is caused by a response of the immune system to an external irritation and can ultimately lead to dialysis and transplant. But Philip is also here to talk about the experiences of other patients as he manages to private online forums with patients and families with kidney issues. So, hi Philip, can you please tell us a little bit more of who you are and how we are living this situation right now?
Well, certainly, Roberto. I'm Phil Smith. I'm pleased to be here. I received a kidney transplant 2 years ago from a deceased donor. I'm fit and well and healthy, and actually was fit and well and healthy right up to transplant time. IgN is a condition in which you are fairly well all the way through. I never had dialysis, and the day before my transplant, I was actually in the gym. So fit and healthy all the way through. I am part of two fairly large kidney forums in which kidney patients talk about their condition, their concerns, and their futures. And I also work closely with Kidney Research UK, and I chair one of their committees called the Lay Advisory Committee, which is a patient committee, which tries to give the charity direction from the position of patients. I'm also in isolation because obviously with being a transplant patient, my immune system is suppressed, and I'm in the most vulnerable group, although I just certainly don't feel very vulnerable. I'm in the house now for goodness knows how long, taking it day by day, quite happy. My wife's sharing my isolation because she obviously doesn't want to go out and bring anything back and pass it on to me. Isolation is interesting, not being able to go out and see anyone, although I'm fairly active on social media, so I do a lot of video calling of friends and family. I'm learning to play the guitar. That's a good thing to do, to do in isolation. Listening to a lot of music, doing quite a lot of reading. It's quite interesting in that it has quite a personal impact on you, isolation, and I can talk, personally. My son and daughter-in-law live in Norway, and six weeks ago, Ingrid gave birth to our first grandchild. Now, it's likely, although we're talking to the family on video all the time, it's likely I'm not going to see my grandchild until Christmas, which is not an easy situation to be in. And the other interesting thing about isolation is that all the way through our lives, we've tended to look after our children and be responsible for them. Now, that responsibility seems to have flipped because they're constantly checking up on me. Am I doing the right thing? Making sure I'm not going out, making sure that things are appropriately in place. So it's an odd situation to be in.
Thanks, Philip. And how is this situation impacting your day-to-day monitoring of your condition?
Well, in terms of clinic visits, I am going to be talking to my consultant over video or over the telephone. I'm not going to be visiting him. I recently had to give a blood test at the hospital. I had to give some bloods because they're monitoring a particular aspect of my condition. I had a little bit too much of a chemical. And there was quite a discussion between me and my consultant as to whether I actually went and did this blood test, because they needed the information, but against that, of course, I had to go into a hospital situation in a blood room where there were plenty of people and there were phlebotomists. So in the end, I did go, but I went at the most least busy time and was in and out in a minute or so. But it creates difficulties like that. I'm not supposed to go out at all, yet on this time, on this occasion, I had to. So it can be awkward.
Okay. And shifting now the focus from yourself to also include other patients, from what you observe in these private online forums or other patient voice that you are hearing, what are the concerns that patients like you are living?
Well, they're obviously concerned about risks and the things that might happen to them as a consequence of their condition. There's been some confusion about where kidney patients fit into the structures of completely being isolated but staying within but being allowed to be within 6 feet of people, not being able to go out, being able to go out for morning exercise. Can they shop? Can they not shop? So there's been a degree of confusion around that. There are issues about the management of their condition. Everything is done sort of online now and on the telephone, which is quite different because doctors make assessments of you, consultants make assessments of you by looking at you as an individual, and I think that's more difficult for them to do when they're doing it on the end of a telephone line. And the lack of information has always been a problem for them, and the fact that information has come out and information has changed. So we're talking about confused messages here, people not being quite sure what they should be doing, when they should be doing it, and how the national picture looks in terms of people who have the disease and how it's affecting them.
Okay, interesting. So in terms of lack of information, what type of information are patients lacking? And especially, what do you think is the cause of this lack of information?
I mean, personally, I think the government were caught a little bit unawares by the seriousness of this. I think that there was a number of changes of direction. We had the government talking about herd immunity, and then saying that lots of people would die and that being unacceptable. So we changed to isolation, and now we're talking about mass testing, and that testing not being enough and not being in the right places. So there seems to have been a lack of clarity, and certainly from my point of view, the government's response seems to have been reactive rather than proactive. There doesn't seem to have been a strategy that they followed all the way through. There seems to be reacting to changes that happen rather than having a planned response. And that's not just from me. That's the information that people are putting on the forums as well.
Okay, Philip, and is it is still now the case, or do you see any changes now in terms of the situation now that the government appears to have taken a more direct approach and clearer?
Yeah, I think it's clearer now. I think it's much clearer now, but that doesn't alter the fact that we've had a couple of weeks of pretty bad confusion and people putting themselves at risk because they were not quite sure what they should be doing or what they shouldn't be doing. And I think it's clearer now. And I think that people are behaving themselves much more now, not only patients, but members of the general public. Although, I was speaking to my brother the other day who went to his local shop, who were supposed to be distancing, 6 foot distancing, and there were a group of older people in the shop just standing chatting with one another, completely unaware of the fact that they should be putting precautions in place so that they didn't pass anything on. So it seems to have most people seem to have got the idea, but there are still people who are not secure in their understanding of what they should be doing.
Okay, and what type of information do you think those patients would need to be reassured on what they should be doing?
I think a lot of the information that's online is very good, but we must recognise that there are lots of people who don't go online. And I think some of the information that comes over the media, the news reports, are unnecessarily complex. You know, you have politicians standing talking for half an hour and senior medics talking for extended periods, whereas things actually, I think, need to be presented to people much more simply than that.
Okay. The other element here in the picture is the NHS. How do you judge the way NHS is dealing with this emergency?
Well, I think the NHS is an absolutely magnificent organisation. I mean, people often say, "What's the greatest organisation within Britain? You know, is it the monarchy? Is it the parliamentary democracy?" And I always say, "No, it's the NHS." The NHS. I think the NHS suffers from a degree of underfunding and have done for years, and I think they're badly prepared for epidemics like this. And I think the way in which protective clothing has been rolled out and the need for respirators has caught the government on the hop, really, shows the fact that although doctors and nurses and anybody working in the health service are doing a tremendous job, they need more resources.
And in your online private forums, do you see concerns from patients around that? What is the sentiment of patients towards the NHS right now and the risk they're exposed to?
Well, what I'm saying really is not just from me, although that's the message coming from forums as well. That patients think that there are not enough resources to deal with their needs. I mean, for instance, you know, there are patients who are suffering, not just kidney patients, but other patients as well, suffering because all their staff for their particular conditions are being pulled into A&E and into respiratory wards. So things are being put back, operations are being put back, particular aspects of their care are being put back. So it shows an under-resourced organisation, I think. But their response to this, I think, now is getting much better by building all the extra hospitals and pulling all the extra people in. But I still feel for people in hospital who feel that they've not got enough protective clothing and not got enough simple things like gloves and protective aprons and masks.
It seems that patients are under a lot of stress because they have the lack of information. You described also the fear that the rest of the population haven't fully understood maybe the impact that the lack of social distancing can have on patients and in spreading the virus. And then, of course, also the NHS, which is under stress. So if we start to think about the type of supports, of initiatives that patients would need right now, what do you think? What is your list, according to your experience?
Well, psychological support, I think, is going to be a quite important one. Most patients seem to be taking isolation on a day-by-day rate basis rather than thinking 4 and 6 months ahead, which seems to be an inordinate amount of time to think that they're going to be locked down. Isolation from families, depression, stress caused about job security. That's figuring quite largely on the forums. Should I go to work? Am I safe to go to work? What's going to happen to me if I don't work? Am I going to lose my job? There's a lot of concern about those sort of things from kidney patients. IT and social media are helping patients communicate with one another well. Renal charities are playing a good part. There's lots of good information coming out from renal charities and renal organisations. They're the sort of things that I think patients are concerned about in terms of their general well-being.
Okay, so if you were to suggest to the government or to other bodies a number one support or initiatives that they can put in place to address those psychological concerns and these issues that you just raised, is there anything in particular that you would recommend government to implement?
I think the government might be it might be useful for the government to be very open about the difficulties that some people might be finding psychologically, and to have experts on there saying, well, in these situations, these are the sort of things that you can do. These are the sort of places you can contact. These are the sort of mechanisms you can put into place in your own life in terms of dealing with stress, rather than just say people are stressed, and recognise it and actually give some practical support. That would be very useful. I mean, there is a recognition that people are stressed and have depression, but to actually say, you know, to have some experts on there saying, well, this is how you can cope with it, would be very useful, I think.
A sort of website or other type of repository where beyond the clinical scientific data and news about the condition, but with content to help patients to cope with that. So all these stress-related issues.
Yeah, and I mean, it would be good if the government could set up a peer support organisation so that people could actually support one another. Set up mechanisms for that to happen, or a helpline for people to contact to say, I'm in this situation, who ought to talk to, or to just give people a voice.
Okay. And thinking now about more the longer term, when hopefully this is emerging, is solved, what do you think is going to change for patients?
That's an interesting one. I think patients are going to be much more concerned about viruses in the future. I think this has certainly been a new thing for me, and that's coming out on the forums as well. You know, just where did this come from? What do we need to make sure these sort of things don't happen to us in the future? Making sure patients, I think, in the future will make sure that they've got their flu jabs and their pneumonia jabs up to date. And I think they'll be looking for information about how to keep fit and healthy and avoid illness, as well as have their condition treated. They'll be looking for a broader lifestyle response, I think, rather than going to the clinic and having their medication checked and altered. You know, I think they'll be thinking more about wellness in the round. What do they need to do to keep fit and healthy, so that if things do come out of the woodwork in the future, they're well prepared to deal with it.
That's very interesting. So what you're suggesting, that patient needs are going to evolve, are going to reach a next level. They really need some sort of holistic information to really manage their disease throughout their life.
I think you're absolutely right. I think what's happened in the past is there's been a focus on the condition.
Yes.
You know, you have this medical condition. My condition was IgAN. I go in, I have all my bloods checked, and my medication is altered as a result of that. But I think in the future there's going to be a much broader thing that actually suggests that people are going to look at their health in the round rather than a focus on their individual condition.
And to satisfy this need that seems very relevant, what the NHS or the healthcare professional need to change in their approach to support patients?
I think they'll need to provide better quality information. I think wellness support is going to be important, rather than just looking at condition, looking at health in the round. I mean, if you go to clinics, there's hardly any information really about lifestyle. There's information about conditions, but nothing about lifestyle really, other than, you know, the general things of having a low salt diet and keeping hydrated and those sorts of general things, which everybody should do anyway. But nothing about mental health really, and about exercise and keeping fit. Early warning about the possibility of future epidemics will be a useful one. Accurate assessment of the danger, so that things don't hit us like a train and that we can see things coming. And I think politicians need to be much more sympathetic to the needs of the population, and to come up with strategies which are realistic. I mean, there was a politician not too long ago who was talking about the virus would be defeated by the British spirit. Yeah, and somebody on Facebook put that actually sounds like cross your fingers and hope you don't die. And that's not the sort of response we want, really. We want an accurate medical response, which is about dealing with people's health across the nation, rather than let's see what happens.
Oh, okay, this was interesting. So you definitely need someone that can really engage with you, can really understand what you're going through. Also in this new scenario, where you talk about this need of more complete information around the lifestyle rather than the condition. And I want to go back to this aspect because I think that's really important. And someone would say that doctors and nurses are already under pressure, are already struggle to deliver what they deliver in the time they have. So to deliver to patients this type of support that you're describing, are you envisaging other type of channels or players in this ecosystem that can help patients really get the information and the support they need?
Yeah, I think so. I mean, I've always been very enthusiastic about health and fitness and exercise. I'm a sort of enthusiastic gym member. Lots of patients are not, and lots of patients lead a fairly sedentary life. And I think if we support them through that, and patients are looking for things that they can be doing. I mean, there's lots of exercise things on TV now, which is a big improvement. Talking about how people ought to be keeping fit during this period. I just think that needs extending into people's lives afterwards. That it's not just about being poorly, being sick, having a condition. It's about general fitness, keeping yourself healthy, keeping yourself positive, and exercise does that. So I think if the government were serious about that, they would be offering free gym membership to patients to get them moving, all sorts of positive advice rather than advice about the condition. Advice about keeping generally well rather than advice about medication.
Yes, almost a shift from a focus on illness to wellness.
Yes, absolutely. That would be magnificent if that happened. I mean, there are good research projects happening in Leicester, for instance. There is a department at university hospitals which is to do with exercise for kidney patients, and there's lots of information comes out of that about how kidney patients can keep fit and keep well, and different levels of exercise for people with different levels of fitness. I mean, I'm fortunate in that I've, other than this kidney condition, I'm not affected by anything. But there are kidney patients who have heart conditions and breathing conditions and diabetes who can do much less, but they can do something. And the temptation is, I think, for some people is to say, I'm ill and I'm going to sit around. And because you're ill doesn't mean you have to sit around. You can be active, and it improves your overall view on life.
Thanks. And last question from my side. Now, going back to your day-to-day right now, but also the day-to-day of patients like you. So you are, and we are, of course, in self-isolation, right?
Yeah.
So what idea do you have on how long this is going to last? And do you have any idea or the type of need or quick information that patient would need today in order to live and to cope with this every day?
Well, I've no clear idea how long it's going to last. I mean, they're talking about people being isolated initially for 4 months. Now they're talking about 6 months, which takes us to October. I mean, that's an awful long time. And it's easier for me because I live in a house. There are only 2 of us in here, and I have a garden I can go into, and the house is big enough for me to exercise in. That's not the situation for lots of people. Lots of people are constrained by other members of the family coming and going who've not got a condition and are allowed out. There's the issue about lots of children being at home. So it's really problematic for a lot of patients. And that's the sort of thing that patients are writing on the forum. How are people coping with the fact that they're in isolation? How do they keep 6 feet away from their children who want to be with them and want to sit on their knees and want to cuddle them? You know, all these sort of things. And I'm not quite sure how that can be resolved other than patients talking to one another and giving one another advice, saying these are the sort of things that we're doing. And it's working for us. You could try that, or the government giving advice through the through their networks about what's safe and what's not safe, and how to keep yourself well. Well, thank you very much indeed.